Yeah, and look, there are things like we call them eye exercises, but we're not exercising the eyes. I mean, the eye muscles are sophisticated and they're much stronger than they need to be for the weight of the eyeball or the weight of the lens that they're trying to shift. And it's all about it being a fine motor control. And when we talk about fine motor control, it's teaching this to control these things, much like doing fine motor control to learn something new.
Mm,
You're not necessarily building stronger finger muscles. You're learning to send the right signals to them. And so when we're doing vision therapy or eye exercises, we're setting up a situation where the person can explore how to use the two eyes together more efficiently
mm,
so that the brain learns to use these organs and point them in the right direction. I mean, eyes are just bits of brain that we point at things, and we
mm,
need to learn how to point them at things more accurately and more
mm,
efficiently and more automatically so that we're not burning up cognitive energy and
mm,
concentration on what should be a sort of a basic skill. And so part of the role when we do vision therapy, and this is the um, why we believe clinic-based or office-based therapy is the most effective way of doing it, is that you can set up lots of different ways to manipulate the balance between convergence and focusing so that you get a really strong generalized skill. And so we might use things like a lens, and you have to find ways of discovering through practice how to make that lens clearer.
mm,
You might move the lens further away and it gets blurry, and you've got to work out how to readjust it. We might even use that lens and say, can you purposely make it go blurry? Okay, so that you're really learning to send the right signal so that you
mm,
as a person can choose how clear or how blurry that image is.
mm,
Um, we might use a way of selecting the input from one eye to the other so that we can create this kind of 3D effect. And then we might manipulate where those images sit, and you've got to readjust your focusing and eye teaming to keep that image single and clear. And so we're able to sort of step out into almost like step into, I should say, into an artificial environment to really stretch the boundaries of that flexibility between the convergence system and the focusing system. And so we have lots of different tools. I mean, a classic one is people have seen the Brock string. That is a tool. A tool by itself, I think it has some limitations, but it's certainly something that
mm,
we use as part of just one
mm,
activity in an overall sort of program
mm, mm,
to help people sort of discover how to use their
mm.
focusing eye teaming better.
Sorry, I'm not familiar with that tool that you just mentioned. Can you
Binocular
explain?
string. So it's a string, and we put beads on it, and you put it on your nose, and it's a way of judging how accurately your eye is landing. So you look at the bead, and then you get feedback on how accurate it is where your eyes are landing. But we can also use it as a feedback tool. Slowly you can move your eyes in and out. So
Mm,
a lot of our instruments are about giving you the patient the right kind of feedback with having a therapist guide you so that you know when you're doing it right and when you're not doing it right. And that's the critical part
mm,
of a good therapy program, is that
mm,
that feedback. It's a bit like doing personal coaching at the gym. You're
mm,
going to learn to use the equipment better in the right way and not the wrong way when you've got a
mm.
personal trainer or a personal coach. And they're also adjusting your program based on the individual goals. And that's what we're doing in the therapy room as well.
Right. So you think that office-based therapy is going to be more effective than, let's say, computer-based therapy? Because there are some like apps and things I think you can download, aren't there?
Yeah, look, and look, there might be one or two conditions if you're, for example, there's some stuff coming into the amblyopia space where
Yeah.
you might be looking at one particular thing that you're trying to change. And so a simple activity to change one thing, maybe that might work. But accommodation convergence is quite a complex system. And so just doing some computerized therapy, the problem with that is that you might get good at the game and then you can't actually transfer it into real life. That's why we need to use different bits of equipment and create these different environments so that you're able to generalize those skills and take them away so that they're working more automatically. One of the risks we see with computer therapy is that if you're doing it by yourself, you might overtrain an aspect. You might find a particular thing, like if you are someone who converges too much, you might jump onto a convergence program and go, wow, this is easy. And because it's easy, you keep doing that part and you avoid training the parts that you're not so good at. And so you can actually create some problems by overtraining the wrong thing.
So, all right. Well, and how long would it typically take for someone to see the difference if they were having a series of office therapy sessions with you guys?
Look, how long's a piece of string? Look, it really does depend on what sort of condition we're looking at. But if we're looking at it that sort of a regular accommodation conversions problem, then we're sort of looking around that 16, 20 sessions to get you a point where you're automatic, that we don't need to do any more therapy. You're probably seeing improvements anywhere between the 6 to 12 week mark, and it's all a bit different depending on how you've presented, because there's a little head of steam. You don't know how to do it. We've got to build some capacity and learning how to do it.
Mm.
And what we've learned is that, if you stop too soon, you haven't made those new skills. You don't own them. They're not a habit. You've got to turn them into a habit. So it's developing a new visual habit so that you're using your eyes without having to think about it in a much more efficient, better way. So we
Yeah.
just need to do it long enough to have that happen. That's part of our review process is how are you going? Are you getting the expected progress? And when can we see that you really own those skills and we can be hands off and you get on with life.
Mm, mm. So it's really sort of like training the brain and your eyes to work together and just making that sort of an ingrained habit with the way that you operate, is it?
Absolutely. Yeah,
Yeah.
yeah. And it's just getting the brain to find the quickest and easiest way to use the eyes without all the extra effort.
Yeah.